Today, I'm sharing a tool with you to help you reach that 100% VA disability. Shout out to this subreddit. They have created a tool that they call Knowledge Base that has every single piece of information a veteran could possibly want. Today, we're only going to cover the master condition list, which is about this much of all the information the mods for this subreddit has put into this thing. The master condition list has every single VA disability a veteran can possibly claim. Not only that, whenever you click on a VA disability, it's going to give you the rating criteria, the symptoms for each criteria, and more importantly, the common secondary conditions of that VA disability claim. That's the secret. Claiming secondary conditions is the secret to reaching that 100%. Okay, so we're gonna pull up the internet here, go to reddit.com. At the top, you're gonna see this search Reddit bar. Go ahead and type in veteran benefits, and this is going to get you to the place that you need to be. Click on veteran benefits, 31,000 members. Once you're here, up at the very top, click knowledge base. And this is the one-stop shop for all the information a veteran is gonna need dealing with the VA. Here's education, employment. This video is specifically gonna be on disability compensation. And then we're gonna scroll down and go to master condition list. And this is it. This is every single condition that you can claim with the VA. This is just the A's. You can scroll all the way down. There's the B's, the C's, and all of these conditions can be claimed through the VA. Now the cool thing about this is if I wanted to claim back pain, I would scroll up and find back pain. Let's see, BA, BAC, back pain. And this is the money maker here. You open up back pain, scroll down. It's going to give you information on the rating schedule for the spine, the back and neck. Keep on scrolling down. Here it is. The ratings on the left-hand side, and you're going to see symptoms per each rating. And so pretty much as a veteran, you need to self-assess and say, hey, here's my symptoms. Here's the percentage I believe I fall into. You have hard medical evidence to prove that you have these symptoms. You have a diagnosis from a medical doctor. And more importantly, you can connect all of this to your time in service. You keep on scrolling down here. There's more notes talking about, hey, neck and back can receive 2 different ratings. All of this stuff is on. This is your one-stop shop. Miscellaneous, other spine ratings, arthritis of the spine, common secondary conditions. This is the secret to 100%. You have your initial claim, you go through your medical records, you claim everything you possibly can with the VA that you can prove service connection to. Let's say you have back pain, you get that claim. Now you're looking at secondary conditions, okay? Bowel bladder impairment, radiculopathy, this is very, very common. Numbness and tingling in the legs, traumatic paralysis. That is a bit much, okay? And that's it. You go back to the knowledge base. You go back to the master condition list, and you can look up whatever condition you want to claim. Let's go to mental health. I'm sure we know we can claim mental health. Let's go down to the M. Mental deficiency. Let's see what this has. Look at mental deficiencies here. Mental disorders. They break them down. How a rater decides, 10 to 100. Alright, mental disorders. Eating disorders. Here's eating disorders by percentage, the criteria, the symptoms of each criteria. We have some tables, stuff that the VA uses to make determinations. Personality disorders, remaining disorder, adjustment disorders, cognitive anxiety, depression, moods. All of this stuff is in here. There we go. Here we go. 10%. If you wanted to file a VA claim for mental health, you would come here and say, hey, do I fall in these symptoms? If the answer is yes, alright, cool, let's look at the next higher one. Do I fall within these symptoms? And mental health has 0, 30, 50, 70, and even 100% ratings. And you could go ahead and compare your symptoms that you can prove to the VA to what's on this knowledge base. PTSD service connection, that talks about service connection here. Combat exposure. Military sexual traumas. Evidence that VA looks at to verify in-service stressors. Guys, everything is in here. If you need help proving your mental health claim, go ahead and look at this list and say, hey, do I have this evidence? If not, am I able to get this evidence? Am I able to get buddy letters? Card up in the top for a video on buddy letters. Common secondary conditions. Again, this is the secret to getting that 100%. This is a warning here. It's telling you if your disability is static and has improved, filing for something under secondary service connection may result in a re-examination of your mental disorder. Irritable bowel syndrome, GERD, sleep apnea, all of these things. Here's DBQs for whatever it is you want to claim, and it's going to link you. This is the form the C&P examiner is going to fill out when conducting your C&P exam. Card up in the top for tips on your C&P exam. And that's it. Go ahead, log on to Reddit, make an account, join Veteran Benefits. This is your one-stop shop for everything Veteran Benefits. You can go ahead and post a question. You can go ahead and create a post, and as you can see, you're going to have so many people answer your questions. So this guy here says, does this mean they're reviewing it? And then you can look at the comments and go ahead and see all of the questions that people are answering, having discussions about, all of that great stuff. If you're a veteran, you need to join this subreddit. If you get value from videos like this, go ahead and throw CIVDIV a like, subscribe, and comment below what you think the secret to 100% VA disability is. This is Clay Sims with CIVDIV, and thank you for your time.